if you are suspicious of a connective tissue disease or arthritis, many times you're sent to an eye doctor. Yeah, wait a minute, I'm worried about a joint that's swollen, and they send you to an eye doctor. Why would they do that?
In children who have chronic arthritis, they're at risk for developing inflammation in the eye. And I can't see it on my kind of exam when I look with that scope that's sitting on the wall. I can't identify it most times, and the child has no symptoms at all. So if we wait for the child to complain that they're having trouble with their vision, then it may be too late to treat it well. So it's extremely important that children who have chronic arthritis see an ophthalmologist, not just an optometrist, but an ophthalmologist to be examined frequently. And the amount of times that you go to an eye doctor in a year really depends on some of the lab tests that are done, and also the age of the child when they first are diagnosed with arthritis. But generally, children will go to the ophthalmologist between every 3 months and every 6 months. So that's very important not to forget, again, because they're not going to complain that they're having trouble seeing.
So if the iris gets inflamed, how do they treat that?
It's treated initially with eye drops, and that would be the first line of treatment by the eye doctor. And they would continue to follow the patient very carefully to adjust the amount of eye drops that the child gets. And if that's not effective enough, then sometimes the rheumatologist helps to give other types of medicine also.
So in other words, if they worry about an inflammation, it can be controlled. You just don't want to have it delayed in a diagnosis with damage could be done. Is that correct?
That's right. Because unfortunately, if this is not picked up and it's not treated aggressively, then it can lead to blindness. But there are very effective treatments for it.